Hello, I'm Judy Stiles. Thank you for joining us for Spotlight on Senior Issues. This series of program is looking at topics of interest to senior citizens, but also their family members who are perhaps helping out parents or grandparents. Today we're going to focus on home care, one growing aspect for the seniors today. And joining me, Kelly Hook, who's helped me host some of these shows, also serving as a guest today, Certified Senior Advisor. Thank you for being here today.
Thank you for having me. Appreciate it.
Well, home care is one aspect that we want to spend a full show talking about, and I guess from your perspective, you're seeing an increasing demand for this type of service for seniors as well.
Yes, people generally want to stay at home if they possibly can. Some people, again, like our other guest talked about assisted living, would rather go to an assisted living facility because maybe they always have enjoyed activities outside the home and they want to continue that. But a lot of people like their solitude, and they do like the quiet and peace of home and the familiarity of the home environment. Some of them have lived in their homes for 40, 50 years.
So they want to be able to look across the room and see that vase they've been seeing on that table for years.
Absolutely, yes.
Putting that together. Well, before I set the scene for people, we're talking about seniors, and people are, well, senior citizens, what's the definition of a senior citizen? And then maybe for even the program, people watch and say, well, I'm not old, or somebody will say, well, so-and-so's old. So what do we mean when we say we're talking about older people?
Well, those things, I've got a slide
we have
here
a graphic on this,
that shows what people actually think about their age, and I know I'm in my late 40s, and I personally would say that 75 is really old, but you can see on this graphic how people in the different decades actually look at elderly or senior as being quite a bit older than what they are.
Right.
Yes.
I'm not old yet.
Yeah.
Right.
But I think generally, if you look at the next graphic that I have, what we are seeing is a trend of a growing population of seniors. And the interesting thing, Judy, about this is that it's really over 80-year-old seniors.
So with the far end of the senior citizens.
That are representing the fastest growing segment now. So we're seeing a lot of people over 80 years old that are still doing well, still living in their homes. But what I see, at least in my everyday work, is that people between the age of about 80 to 85 and then into their 90s start needing some kind of assistance in home. Now, these seniors may not need nursing home care, but they start having difficulties that they may need assistance with.
So thanks to our advances in medicine, people are able to live longer.
That's correct.
But as they're living longer, they're facing some challenges other generations in the past didn't have.
Right. This next slide that I have talks about what we're calling actually the silver tsunami. It's a term that we use in our industry, and it talks about the boomers who are now becoming seniors. And they began turning 65 in 2011, and the youngest of them will turn 65 in 2030. And then we're going to be looking at 1 in 5 Americans over the age of 65 by 2030. So that's about 20% of the U.S. population. That's a huge number of people that are going to be looking at options. Even if they aren't right now, they will be looking soon for options, and may already be doing that for their own parents who are now living into their 90s.
So we're hearing this across the generations and across different topics on the news. You know, people are concerned about all sorts of issues.
People are living longer. We've got good technology. We've got lots of medical advances, and so it's not uncommon to have people in their 60s and 70s taking care of a 90-year-old parent.
So, so the sandwich generation doesn't mean you have young kids around the house anymore.
Absolutely, absolutely.
So you have some challenges as we hear about the baby boomers getting older. You have another graphic tying into those.
About that, just talking about boomers being very educated. A general rule, boomers are very educated. They're very tech savvy. They're on the internet all the time, and they are not going to go quietly into old age. They want to have choices and options available to them. This is a generation that doesn't necessarily believe that whatever the doctor says is 100% the truth, and they're going to question things. They're going to question their options, question their doctors about different types of medication, question their doctors about different types of procedures and things, and they want to know that they are going forward with more of a plan. In the generation before the boomers, a lot of times, and especially in my grandparents' generation, when they went to the doctor, it was like they literally were going to see God.
God says you do this, they
He
say,
said
okay.
that you better take this medicine every day, and they would go home. They wouldn't read the instructions. They wouldn't read the side effects. They would just do exactly whatever that doctor said. And the problem is at some point in time, maybe they needed a specialist or something, but maybe they were still going to the family practice doctor that they were seeing when they were 20. There's a lot of difference between 20-year-olds and 80-year-olds and their differing needs.
And we're seeing that change in general in medicine as well, with doctors who specialize in care for senior citizens.
Absolutely. They're called gerontologists, and there's not very many around, but I think that is one of the things we are going to start, a trend, I hope, that we're going to start seeing here in the near future, because we need more gerontologists who specialize in the care of our seniors. I really feel personally that I know in nursing, I'm a nurse, and we have different specialties in nursing. And pediatrics is one of those specialties. I feel like our senior population is a specialty all in of itself.
Because you have different health considerations when you're old versus when you're young.
And medications work differently on seniors, and it's the same thing with pediatrics. There's different things that happen with medications in pediatrics that, you know, the regular nurse on the floor that's doing medical surgical nursing may not have been trained for those. It's the same thing with seniors. They come in the hospital, they get hallucinations because maybe they have some dementia. There are special things that we need to do in the care of our seniors, and I really would like to see that the progression of more specialists in gerontology, more gerontological nurses and nurse practitioners that can actually really meet the needs of this growing population.
So society continues to adapt to the growing demands, and one of these is the fact that, you know, more people want to stay at home, like you say. So home care is one of these aspects we're seeing.
And on my next graphic up here, we've got a couple more statistics. About 90% of seniors will say that they want to stay in their own home as they age, and 82%, which is a large amount of those, want to stay even if they know that they're going to have somebody from the outside that's going to need to come in and help them stay home. So that can be a little bit of an interesting situation when you've got somebody, I want to stay in my home, and then they're like, but I'm not letting a stranger come in and help me. So families can really get, okay, well then what are we going to do? Family can't necessarily do all of the care. So they've got, they 82% say that they are actually willing to have another person come in the home that's not their family come in and help them. They want to be in a familiar environment, a place they love, near their neighbors and friends, and they want to feel like they're maintaining their independence and their well-being and health.
I've been here all my life. I really see no reason to leave now, and I'm happy living here, and if I can't get up and move around, I still want to be here and be in that home. Right. So that, you mentioned families, that places a challenge on the families who are dealing with what do we do because somebody needs some more help in the house. Right.
Families are absolutely critical in helping their loved ones make the decision that, hey, it's time to get some help. And families are going to be critical in helping their loved ones do the research necessary to select somebody to help them. I've got a graphic here that talks about long-term care and explains what ADLs are, because that's kind of some terminology.
One of those terms that people use. What's an ADL? Right.
Also, we talk about IADLs, and these are specifically things that can be done in home by a provider in home, a caregiver in home, that's not necessarily family.
So tell me what ADL stands for.
ADLs are activities of daily living.
Okay.
And activities of daily living involve the bathing, dressing, grooming, using the toilet, transferring from the bed to a wheelchair or something like
Things
that.
Things that we do without really thinking about, but it's
caring for the person who's having some incontinence issues and bowel issues, and then eating. Maybe they have trouble preparing food, but also they have trouble actually eating.
The swallowing or whatever's involved.
And then the IADLs take into account things like managing money and housework and taking medications and going shopping and doing those other ancillary duties. And so a caregiver coming in home can help take some of this burden off of the family members, to where maybe the daughter is now helping with managing the money and the shopping, but an in-home caregiver is coming over and helping with all of those activities of daily living, plus helping to care for the pets, helping to remind that client to take their medication. So the list for the family caregiver just got a lot smaller of what they have to be responsible for.
So this then sounds like it takes communication between the person who's providing the help and the family. Just,
Yes.
how are we going to split up this new, we have someone
Right.
to help, but what do you want us to do?
What do you want us to do? And I always love it when I go into a home and they have got a list of things that they really would like to have help. And if they don't have a list, I have a card that I take them that's got 50 ways we can help you. So that even if they're like, we don't really know what you all can do, I can share with them, hey, anything, even addressing and helping to mail cards. My grandmother used to never miss a birthday, wedding anniversary, and she always made out her cards ahead of time. And it got to where she was so crippled up, it was really hard for her to write.
Use the pen to write.
And the addressing those envelopes and helping her write those cards and putting a stamp on those and making sure they get to the mailbox, that's priceless.
So,
it means a lot.
You know, sometimes first, I guess, initial reaction from people, well, do we really need your help? You know, people, as human nature, as you say, some people don't want somebody coming in to help them.
Right.
So you have to get over that hurdle.
Exactly.
What you can do. So we're talking about in-home care and these ADLs. It's not necessarily the medical aspect, it's assistance.
That's correct. That's correct. There are Medicare solutions that can take care of the skilled, what we call skilled needs. So if somebody's coming home from the hospital and they need wound care, or they need dressings changed, they need shots, or they need IV medications. Those are things that a Medicare certified skilled home health agency would provide, and Medicare or private insurance would cover those things. When that patient is done with those treatments and then needs help eating, needs help to get up to the bathroom, maybe needs some companionship and assistance, needs somebody to run the vacuum cleaner and make sure that they're eating their dinner and taking their medications, that's when the non-medical in-home care can come in and really add to the quality of life for that client. And we really work in tandem and hand in hand with home health and hospice to make sure that the clients are getting sort of a well-rounded care plan, and that we as non-medical home care providers are actually assisting the home health company or the hospice agency to meet their goals in the care of the clients.
So
we don't work against them.
Right, you're working
we work
together,
with them.
so you're
Absolutely.
maybe both providing services to that family at that time or to that patient.
And the best case scenario is when I, as a nurse, or my other nurse that helps me, is talking directly with the hospice nurse or the home health nurse, and we're creating this plan of care together that is going to really help the family and also the client. Those are great scenarios.
You really have that coordination and tying everything together.
Right.
So we have those examples that you've provided. So that people hear terms home care. You've got the home health, the in-home. There's different types of care that people can provide in the home.
That's right. And it really there's a lot of things that we can do in home. I tell people that, you know, my grandmother used to think it was either she was home and she was taking care of herself, or she was in a nursing home.
The only thing we do is we leave. Right.
You know, that there wasn't any options in between. And now there are many options in between, and there are so many things that you can actually do in home. I think I've got a graphic that shows usually something about private duty caregivers. Now, what I did want to kind of go over in this slide was talking about the difference in, you know, a lot of people will put an ad in the paper, need home care
Someone to come over, help grandma,
to help
come over.
grandma, you know, 3 days a week. Or they go on Craigslist and look for somebody like this. And I want to kind of look at the differences between the private caregiver and then using an agency for caregiving.
There are companies and agencies that will provide that.
So a private duty caregiver, this shows up here, you're usually going to cost between $10 and $20 an hour. The family is going to negotiate the price with the caregiver themselves, and this is going to be out-of-pocket cost. Usually long-term care insurance plans will not cover a private caregiver. So if you are planning on using a long-term care insurance plan, you want to check with that insurance company to see if you need to go with an agency or if they will pay just anybody to come in and
check
do the
what the policy says.
Check.
Right. Mm-hmm.
And then one of the things a lot of times that people don't realize is that family members are responsible for managing and paying taxes and everything for their independent caregivers.
So even if you hire that person to come in on your own,
Right.
the government wants you to keep track of that for the taxes.
If you go to the next slide up there, it kind of goes into a little more of a description on where to hire, where's a good place to hire a private caregiver. You can look through ads, referrals, registries. You want to look and see if they're hourly or if they're live-in. Live-in means that they would stay there 24/7. You can locate them sometimes from senior centers, churches, newspapers, Craigslist, direct mailings. If I was looking for a private duty caregiver, of all of these things, I would look for a referral from somebody who actually had that person working with them.
So ask the questions as the family or the members are trying to find people. Do that research.
Right. If we can go ahead and go to the next slide, we talk about asking questions. So before you hire somebody that's coming to you privately, ask about their previous work experience. Don't just look at their smiling face and maybe they're cute and sweet and giggle a lot and think, oh my goodness, this is going to be a great person to take care of grandma. You want to know what kind of experience they actually have. Have they done this before? I've had people come into me and say, well, I took care of children, I should be able to do this, or I've been a mom. I'm not saying you can't do that, but to me that's not somebody who really has had the work experience specialized in this area.
Dealing with seniors, what have you done to help seniors out?
You want to know what kind of caregiving experience, actual caregiving experience they've had, and this is important. Why are they a caregiver? Why do they want to be a caregiver? It can't just be because I need work and I need a paycheck. Please don't hire somebody that says that to you.
I'm out of a job and this sounds like something I can do.
I really, and you know, I'm a live-in caregiver because I really don't have a place to live right now, and this would just be great because I have a place to live. Please don't hire.
Little red flags should go up with some
little
of those
red
responses.
flags. And then ask them. That's a very good question. If we could go back to that last question there. The reason for working on their own rather than with an agency. There's a good, you know, why are they doing that? What are their reasons behind that? You might come up with some really interesting reasons.
People might have some good reasons too.
Exactly.
They just made that a personal decision.
So go ahead now. You can get to the next
hiring
one.
Tips, right?
Hiring tips. Rely on your instinct as well as research. I can't say this enough. Do reference checks. Do background checks. Check their driving record at least and their background. Do a urine drug screen. Check them for that. And this is one of the things with a private caregiver. It falls upon the family to do these things. And one of the things that a good agency is going to do is do those things for you. They'll have that already done. And ask about their training and their qualifications and experience. Somebody who is a nursing student at Crowder in their second or third year of nursing school and has their CNA already would be a really good pick, and you'd know that they had some experience, and also you would know that they really actually had an interest in the field. Wasn't just a job to them. They're actually going into a nursing career. This is actually how I started my career as a nurse. I was an in-home caregiver for an elderly person.
And so this is something
this is something that's lasted my entire life.
And tying of all that together. So a lot of research people looking, and I noticed in the graphics you've talked about, the different choices as far as the type and the frequency of home care. So if somebody just needs help in the morning with somebody getting out of bed and brushing their teeth and bathing and whatever it might be, they don't need to be there all day. You can arrange for that type of time.
You know, especially if you're looking at a private caregiver that you're hiring, you want to make sure that you tell them what it is that you're really expecting from them, what hours of the day that you might want them to work. This is another graphic that I had that I think is really important to remember. Going back to that,
comparing the private
comparing the private. So it's good for you to know that if the employer responsibility would be for taxes and payroll and workers' comp, But the family, if they hire somebody privately, would be responsible for all this. And this gets really sticky in a workers' compensation situation. Say mom is bedbound and you have a private caregiver in, and they hurt their back when they're trying to lift on mom or move mom. That actually falls on you as a family member or on your parent to provide the care and to see the doctor, and if they have to have surgery.
So the law says you were working at the time when you were injured, so you're responsible
and
for
so
this care.
you're responsible. So that can actually, really destroy a family's finances if something like that happens. Again, an agency is going to be in a situation where they're going to provide that coverage. Go ahead and go to the next slide, where we start talking about a little bit about the differences. The non-medical in-home care agencies do the same types of things that your private caregivers would do.
Okay.
The bathing, the grooming, helping with the ADLs and the IADLs, the shopping and things like that. Go ahead and go to the next slide. But there's a few things that I know my company does and a lot of other companies do. A comprehensive assessment by a registered nurse before the patient is brought on care. So even though we're a non-medical company, you've got a nurse's eyeballs getting laid on that patient. We're looking at their physical and mental status. Are they confused? We're also doing a medical history review. We do a home safety inspection to see. One of my biggest things around here is homes that don't have smoke detectors in them.
People don't have those
People don't
basics
have
of
the
keeping
basic
themselves
smoke
safe.
detectors, carbon monoxide detectors. We look around for fall risks. You know how grandma always has the throw rugs
Right,
everywhere.
walk in the door, they have a rug to wipe your feet on.
And they're trying to get around all these with a walker. So looking at fall risk, medication reviews, and making a care plan so that when our agency caregiver goes into that home, they actually have about a 9-page plan that they can follow and use in the care of that client. We go over those plans of care with the family as well as with the caregivers, so the caregivers are not going in blind and they kind of know what to expect. They know what meds the patient's going to be on. They know what the expectations are from the family.
Now it's getting things started. Now do you have follow-up plans for if people progress, their conditions change, and so forth?
Yep.
So you need to
about
follow.
every 6 months those get redone and retooled. The other benefits, if you'll go to the next slide, that just want to go over real quick is just one of the biggies is we oversee the care. So there's supervisors for those caregivers.
Okay.
There's somebody that can, when the person is sick, can actually find you a replacement. That's a big one. Schedule and coordinate care, and somebody that you can call with your complaints. You don't have to get in the middle of complaining with the caregivers. You actually have a supervisor you can go to and somebody to look over that. So I think those are definite benefits. Go ahead and go on over
One more
to the
slide.
next one.
Okay.
Yeah.
They've got the next one. There we go. Look, how to find them.
So, the next question is, how do we find a good?
Where do we start?
Where do we start? There's many different places you can go. Home Care Association of America. One of the ones that I like, an Area Agency on Aging should have a good list, and we talked to Stan from Area Agency. I like the bestofhomecare.com. You can you can go in there and you can put your zip code in. And the thing I like about bestofhomecare.com is this is specifically agencies who are paying attention to quality, meaning they have a third-party company who is coming in and they are randomly selecting 10% of their clients and 10% of that agency's caregivers, and they are doing surveys of
So
those
it's like an
caregivers.
outside assessment.
Absolutely. And you can go on there and see if there's a best of home care agency in your area and whether or not they have won some awards. And some of those agencies actually post their patient scores each month on there. They actually have them open so that you can actually see what their cumulative score is.
So people want to know how can we compare. That gives them some statistical comparison.
Very, very important. So there's a lot of places that you can go. There's also like caring.com, Place for Mom, different websites. If you, again, Google in-home care in your area, you'll have some agencies that'll pop up as well as some other resources to find a good match for you.
Of course, we're recording this program in Joplin, and Joplin is a good-sized metropolitan area. A lot of smaller towns surrounding us, so people might be watching from one of the smaller communities and wondering, do we still have services available in some of the outlying regions?
Absolutely, you do. And it's very important. that when you are doing your research on a company, you do ask them what communities and what counties that they cover.
What's your service area? Right.
Right. What's the service area? And you know, a person in Lamar, for instance, doesn't necessarily have to have a caregiver all the way from Joplin. I know personally, we hire caregivers where our clients are.
You want to live close to the one.
Exactly. We don't want people traveling a long ways to their job, and so we try to hire people that are where the clients are, that are local to the clients. That way too, we have less issues when there's snow and ice, when there is bad weather, and also if there's maybe an emergency come up where a family needs some extra help.
So you can have those situations where you need some flexibility. And
Exactly.
say, you know, we usually have you Monday, Wednesday, Friday, but Tuesday I really have to go to the doctor. Can you come in an extra day?
Right, exactly.
And tie all that together. So a lot of opportunities, things to look at. Can people also get specific, say, an elderly man says, well, you know, I really want to have an older woman versus a young girl, that type of, they can try to work with the agencies and what they want to have.
Yes,
sometimes.
and we're equal opportunity employers, and we don't discriminate or anything like that, but we do have to take into consideration that these people are paying for their own care, and we do want them to feel comfortable. So if an elderly lady is not comfortable with a male caregiver, we're not going to send a male caregiver to her. That might frighten her to death. If a gentleman is not comfortable, we will do our best to find a caregiver that is suitable to the family. And we feel like matchmakers sometimes, because the caregivers want to feel comfortable in the home too. So I do my matchmaking and try to make a really good match between the client and the caregiver, so that both have a happy ending, so to speak.
Well, before we run out of time, I know you mentioned your start in the caregiving. For people who are watching, the younger generation, this would be a growing field perhaps for college students or even high school students to think about in the future. Medical
is definitely going to be the wave of the future, and I think the earlier that you can get involved and the earlier that you can decide whether or not this is for you, the better. When I was in college, I started caring for an elderly lady. Loved it. If you become an in-home aide or you become a caregiver at a nursing home or that kind of thing, you will quickly realize whether or not this is for you or not. And if you can't be a really good employee in that kind of situation, then chances are you better find a different career path for yourself. But I encourage young people to get involved early, to develop especially a love for our seniors, because they deserve it. We have, as a younger generation, a lot we can learn from our seniors, and this is a really great opportunity to do that.
Do you find a lot of times that the clients, the people in the home, are sharing their stories with a younger generation? They just want somebody to talk to?
They want somebody to talk to, and they want somebody that'll listen. And I really love it when I have a 20-something or even a teen come into my office and say, I'll say, why do you want to be a caregiver? Well, I just love to listen to their stories. I love to hear what they have to say about, times before I was born. And I don't want to lose that in our communities. I want to make sure that we're preserving the memories of our seniors, and I think the caregivers are definitely some of the people to do that.
Helping them out and doing that. Well, Kelly, I'd like to thank you very much for being on this portion of the program of our series and talking about home care, one of the many aspects of what we're talking about with the Spotlight on Senior Issues.
Thank you for having me.
You're welcome. And I'd like to thank you for joining in for this portion of the program. As you recall, we have a series of programs looking at senior issues. I hope you can join us for the other programs as well. I look forward to seeing you then.